Hey everybody, I am with Dr. Kocak and Dr. Tiwari of Midwest Breast, and they wanted to come on today and give us an update about the current climate with coronavirus and how it's affecting elective breast surgeries and their patients. So I'm going to let them take it from here and give us a brief little update of how they think, things are progressing, if they are progressing, and what they think of the current coronavirus situation.
Yeah, I mean, first, I think we want to start by saying we know what a um, anxious time that this is for people. I don't think anyone has ever experienced anything like this, and particularly for our patients, our breast cancer patients, breast reconstruction patients, our on-block patients. It's really very difficult to be dealing with this challenge, particularly when you're not feeling well, you're feeling sick, you've got healthcare issues, certainly apart from the coronavirus. So I just want to say that, our hearts go out to you, and both Dr. Kocak and I are always available for questions. It's part of the reason we wanted to do this video is we have gotten a lot of questions. We want to be able to address patients and kind of talk to their needs as much as we can.
And I think one thing we can say straight out the gates here is that even though this may put a delay on some of the procedures that people were looking to have or maybe planning to have, even around something like an immediate cancer, the good news is most of our procedures, almost all of our procedures, are things we can do at a later date. And so once this kind of goes away and once we get back to normal activity, all the things that you were planning on having or looking to have done are going to be a reality, and we'll be able to get back to those things right away. So I think it's important to understand that just because it might be delayed, it's not gone.
So
Erica, I
yeah,
think you said you had some questions, right? That people have been sending in some of the more popular questions and comments that we might be able to actually go through. I think that'd be a good idea.
yeah, absolutely. On that note, can you talk about how the situation with coronavirus has changed day-to-day operations at Midwest Breast?
Sure.
Sure.
Yeah,
I'm
I
going to
can
let you
start.
take that, Dr. Kocak, while I close the door out here.
Okay, sounds good. Yeah, I mean, definitely major changes. So, and a lot of our changes have been in response to the changes that are, the recommendations that are being delivered, at least at the state level right now. In Ohio, our governor's done, I think, a very good job of being very proactive, and we've been taking, I think, very adequate and early measures. And so, as part of that, they have restricted pretty much all elective operations at hospitals and ambulatory surgery centers. So for that reason, we have pretty much canceled every operation that we were planning, including any elective operations that were ranging from sort of the phase 2 cancer reconstruction operations, the implant removal and capsulectomy cases, and even the immediate breast reconstruction cases where patients who had active cancers were planning on having a reconstruction, because it's been pretty clearly outlined that we should not be doing any surgeries that will tie up the resources that might be critically necessary as we move further into this epidemic. So really from a surgery side, we shut everything down. And on the clinical side, Dr. Tiwari, I'm sure, could comment.
Yeah, we are still actively seeing patients. We have patients that we've operated on, and we want to be available to those patients, whether it's in person for visits that we will certainly be able to coordinate for patient care, or through telephone calls, internet evaluations. There's a lot of mechanisms that we can use to make sure our patients are getting cared for, whether they're local to Columbus or far away. We get so many patients from around the country that we have a pretty good mechanism for following up with patients, and also creating new consultations for patients that aren't in our immediate area. So our office is, still fully functional, but certainly it's been a big change to the normal day-to-day, as it is for everybody in the country. But for us, our main goals are to support the state and local efforts to keep people safe, while still kind of keeping our patients' needs as a priority.
Okay, great, because that was a question that came in. So just to reiterate, you will still see patients for consultations virtually.
Correct.
And then patients who have maybe just seen you for surgery, you will still keep the visits as long as you can for, if you need to, for post-op.
Absolutely.
Yeah,
Great.
the goal really is to minimize taking anyone out of their homes and bringing them into a space if we can avoid it. So we're really trying as much as possible to avoid that. But given the nature of our work, sometimes that's impossible. Even with patients who have had recently had surgery, they might have drains. We have some pretty good resources that we can share where even patients could take their own drains out when the time is right. And we can determine that through phone calls and virtual consultations and virtual follow-ups. And I think by doing this, we'll be able to minimize the number of people that have to actually leave their homes and physically come into the office. But the office will be functional, and we will be seeing patients that absolutely need to be seen when that comes up.
Great. And I want to ask, because this came up, is there a certain patient population that you might be more concerned about too with regard to exposure?
Yeah, it's a really good question. I think among the patients that we see and the patients that have been sort of identified as the most at risk for COVID-19 are patients with some level of immunocompromise and patients above 65, 70 years of age. So the immunocompromised patients for us tend to be patients who've recently had chemotherapy or actively receiving chemotherapy. I think those patients have to be very mindful of their exposure risk. For patients that are older than 65, older than 70, just based on some of the data that we're seeing, those patients really have to be very careful about exposure and possible respiratory issues as a result of the virus. So those are really the two groups, the chemotherapy patients and the older patient population that we're really being very mindful of seeing them in the office and any face-to-face interactions.
Thank you for that. And then looking to the future, when all of this is hopefully over, do you guys have any projections for when you can schedule surgery again, or how are you handling that?
So from the surgery side, I mean, first of all, this is going to be something we evaluate almost daily, if not every week, kind of figure out what's happening in the immediate days and weeks to come. We don't really have an exact time frame for how long this restriction will go on. Obviously, we're looking to the guidance from the state level and probably at some point the government level, federal government level. But in compliance with that stuff, we're going to keep a close eye on these things. And as soon as there's a window and it looks like we'll be going back to being able to do these types of procedures, and they may come in different phases. It might be that we may be able to do some of the immediate reconstructions before we actually go back to fully elective procedures. We'll see. We'll have to wait and see what we hear. But right now, we're going to be seeing our consultations virtually. We can be talking to new patients or patients who are looking to have procedures, and we'll be able to actually get all the information. We'll be able to document it in our charts. We'll be able to go through and figure out what might be the best plan, and then tentatively look to schedule these procedures. We're thinking right now, probably at least tentatively start to put June dates on if they're available and later. And we would pretty much, if those do end up coming to fruition, if they are open dates, we'll be able to see the patients face to face before their surgeries for pre-op visits. So for right now, I think any type of person who's having an immediate reconstruction or wants an immediate reconstruction, it won't happen at the exact same time, but we can try to do it as close as possible so that we can still benefit from what we would have benefited from in the immediate setting, which would mean some of that extra skin that's left behind that we can usually incorporate into the reconstructions. Those patients, we've done this for a long time. We call them delayed immediate approach, and that would mean that we kind of put off the big reconstruction and do a smaller thing up front. In this case, we would just not do anything and come back as early as possible and do the definitive reconstructive procedure. So from a procedure standpoint, though, like I said, we're definitely going to keep trying to potentially pencil dates in and get patients in physically face-to-face appointments for pre-op appointments before their surgeries.
Yeah, I think it's really important to notice that this delayed immediate protocol is something we use a lot. So even if we don't do the reconstruction with deep flap or S-cap flaps or Doug flaps at the same time as the mastectomy, we can still oftentimes get a very natural, normal result. We're fortunate that with Ohio Valley Surgical Hospital and Onyx and Pearl Surgical Suites, we have a lot of flexibility when it comes to scheduling patients. And I think as soon as some of the regulations have been addressed, I think we'll have a really good likelihood of getting patients to surgery as they need it. And this is also true for breast implant illness patients. patients who we've had to reschedule for total en bloc capsulectomy and implant removal. And I'm hopeful that as soon as the regulations are reevaluated, that we'll be able to get people scheduled as soon as possible. Right now, it looks like June. Hopefully, it'll be sooner, but we just don't know.
Well, thank you, Dr. Tiwari and Dr. Kocak, for answering questions from the community. Is there anything else you want to add or you want people to know?
I mean, I think from my perspective, it's like the first thing we said when we started the call is that I think everyone, while it's very, scary and a lot of uncertainty, I think we have to reassure everyone. It's important to know that while this may create a delay in some capacity from the things we do, implant removal, capsulectomy, breast reconstruction, all these procedures will be able to still come back and get them on as quickly as possible as soon as we have the ability to do it. And we'll be able to still get the results that we really would have gotten in the first place. I'm pretty confident that we'll get back to this relatively soon.
Yeah, I mean, stay safe, everyone, and we hope to see everybody in person soon.
And we're always open to any questions in addition to these. You can always send questions to we have an info@mwbreast.com, which is our general sort of information email. Certainly reach out to us. We're more than happy to field questions and thoughts. You can also reach out to us through our social media outlets. We're always willing to take questions and field them there as well. So
thank you, guys.